Good morning, everybody. Welcome to R&D Unplugged number 13, our lucky number. With our own Olga, I will let her introduce herself. She's all over the planet. She will tell you about co-design approaches to complex challenges. Olga, over to you.
Thank you, Shab. So I need to stay in this window, right? Come on. Okay.
More space.
So at least it's not Friday 13th. So yeah. But yeah, welcome everyone. Great to be here. Please let me know when we're around towards the time you want me to end, because I feel like I can be talking for a while. So I try to come up with a title to kind of give you an idea of what we do and bridging disciplines. So how do we bring together different communities, different types of stakeholders across different groups, and how co-design and engaged scholarship can somehow help us do that. And we'll talk about those issues, and I'm sure that all of you in many collaborative projects encountered some difficulties of how do we bring different communities from different cultures, from different settings together, how do we facilitate those type of groups. So we do research and practical work that is connected to that. I'm not going to spend a lot of time in there, just to tell you that I'm not a traditional academic. I did spend a lot of time in industry, also in policy making with the French Digital Council. My background is actually in engineering in the semiconductor industry, and I moved into studying somehow innovation and collaboration as my PhD and continued ever since. And I feel the need for that and the dream to do so was kind of, the more I worked in the technology, the more I realized that it's actually the human aspects that we need to focus on and actually see what type of support tools, processes, methods we need to put together to actually do so. And I'm passionate about healthcare and complex challenges, and I also work in women's health and support a company called Minty here on how do we bring issues related to women's health in the workplace as well. And I recently joined the University of Sydney, so I'll be, as Shab mentioned, very global, so I'll be spending my life in between France and Australia in the future. When we talk about complex settings such as healthcare, veracity, education, I mean, here are just some examples of what we've been doing before. For example, in New Zealand, around launching the whole lab for veracity, trying to capture that in certain forms of toolkits of how do we bring those topics together. This is just to give you the examples, but why do we do that in the first place? We all know that addressing complex challenges like healthcare, education, looking into systemic change requires somehow it's really important to bring different stakeholders and different groups together, and it's across multiple levels of engagement, NGOs, governments, researchers, industry, but we all know how hard it is. As I mentioned before, we are all having divergent interests, divergent goals, power asymmetries, global north, global south. It's one of the contexts. How do we do it with equity, with integrity, with inclusivity, and how do we overcome those coordination challenges? So that there has been quite a bit of research happening in this space, and the main overarching goal, I think, of a few projects that I'll share with you, it's really how do we organize and study collaborative work across disciplines and domains. For example, nexus of health, food diversity. So it's not necessarily one specific discipline, but how do we bring nexuses of things together and all the challenges it might represent? And all of that across different organizational forms. For example, it can be a citizen science project. It can be an open innovation project within an organization. It can be just coalescing multiple stakeholder groups together. So we've been interested in different organizational forms that will support or hinder, in some cases, those type of settings. And my practice, just to illustrate it even more, why do we think it's interesting and important and somehow challenging? It's really how do we integrate not just the systems level, but the end user perspective. If you think about healthcare, for example, a nurse in Zambia who is looking into guidelines from the WHO, she will need to think how to integrate better care practices for the kid she's treating on this photo. But then, for example, she's using a certain technology to address certain aspects. So how this interface is playing out. She's in a certain space that we need to take into account when we design and embed things into practice. The neighborhoods, the infrastructures, and then the systems of care. So when we talk about complex healthcare challenges, we need to integrate all these different levels. So we have different stakeholders and also different levels of complexity that we need to embed into the ecosystem to be able to understand how things will work in practice. Because we all know that when we don't do it, and I mean, we can have the most amazing innovative project, the great technology, but if we don't think about the ecosystem and how these things are integrated, essentially it creates lots of frustration and we fail eventually in those type of projects. I think we've been all seeing a very, like lots of genius ideas coming from entrepreneurship, but if we don't think about how do we integrate that in practice, it's really hard. And essentially all these innovations are part of these ecosystems of different things. So what's the interoperability? How do we integrate that in practice? So this is somehow the context of what we are trying to grapple around. And I think what Learning Planet essentially is doing is somehow connected to that from the educational perspective. So how do we change systems around education and how do we integrate that by having the end user perspective in place? So it has to be human-centric. Where do we come from? So I love the work of Van de Ven, for example, on engaged scholarship. So we are embedded in context. Some of those studies take time because change does take time. Some of them are shorter. So we're considering phenomenon in motion, being embedded, being in process of different works. And I'm happy to share these references with you as well. So process model, we use narratives for this. Mechanism, we see how things need to be involved and we try to build models of realities based on that. There are different ways to theorize from processes, from longitudinal studies using Q-design. We can talk about that even more, but essentially these are the processes of sense making, sense building, and sense giving across different levels in the organizations. I'm also using somehow in my research practice lots of design methods, and we're going to talk about some design projects as well, like participatory design. This is the figure I borrowed from Sanderson 2008 to basically talk about participatory design in action. You have applied ethnographies, you have systems mapping to action-based research. So for example, in my PhD for 3 years, I was embedded in the semiconductor company to work across and actually to be in the advanced R&D teams. So you pretty much learn from them, you brief with them, you do things with them, and somehow it kind of obviously influences your way of looking into things at the same time. So this is just to give you a little bit the perspective of where we're coming with from these projects. And as I mentioned, all of that happens across different organizational levels. So it can be, and these are the studies I'm going to share with you, for example, the guidelines development in the context of World Health Organization. So World Health Organization, its main focus is really how do we develop new evidence, synthesize evidence, and then make sure this evidence is accessible to anyone in need in different countries. So distributed setting, organizational form, in a way, it's ministries of health in different organizations, and how do we design for that? So that's the level of complexity. And some other forms are very organizational forms, like, for example, the project where we've been involved together with Mark as well a few years ago. It's really epidemiology. How do we bring together an extreme community of data scientists, patients, ethnographists together, and many, many other individuals to actually see whether having something which is radically open can lead us to change the way science works. And then you can see some others, but I'm happy to share some examples and I'll guide you through some of them, showing what's the particularity in there as well. So the first one that I'm quite passionate about, because it's been a while, you know, the change in big organizations take time. So I'll show you some of the specificities of this project, and it's a very collaborative effort, and you'll see in many of those projects, actually, I'm fortunate enough to work with many amazing colleagues. So this project started as a collaboration with Monash University, and we've been working with the World Health Organization for now 3 years to look into how design can support guidelines developers. Today, when we design the guidelines, the problem is we have amazing experts, scientists, experts in their specific disciplines. They will synthesize evidence. This evidence will be produced in PDF forms, usually not integrating different forms of comorbidities, meaning that it's not patient-centric, but disease-centric. And we do not necessarily take into account the nurse in Zambia that I mentioned before, who will be accessing those guidelines and trying to use them. So how do we make sure that we will develop certain principles and tools using design to actually help those people working in the ground in different countries to actually make sure that they have, that their needs are integrated in those things. So this is just to illustrate the longitudinal process and how long it can take. So it's been ongoing weekly meetings of WHO since 2022. So it's been 3 years, different workshops. And you can imagine the organizational level of co-design will take 6 months, right? Like we can do 4 workshops. Here, since you bring and coalesce communities of stakeholders coming from different countries, it's a very long process of consultation. I'll show you some examples that we've done, but essentially we managed to redesign the template of the WHO to actually work on some guidelines and produce some design principles that are currently being used. And it started as a way of, okay, how do we, I mean, it's a pretty traditional co-design process for some of you who are aware, so how do we actually think about personas, the real people on the ground, to bring them as a perspective to WHO? So here, for example, Dr. Helena, and the idea was really to make them feel and think about the experience of these different people and actually relate to them when they do the design work in there. So this is the first scenario where they worked in the very first workshop in 2022, fatal injury surveillance, building guideline, and pretty much the personas were real people on the ground who we interviewed. And Dr. Abbasu, who participated in the workshop, he actually recognized himself. Even if the names, of course, are changed, they're very different. So all of that to say, okay, how do we do design at the very large scale in this case, but integrating the needs of the real users in this particular case? Where this project is currently, so we've been able to design principles that are publicly available now on the WHO website, which is also a very long process. So there are 5 design principles. Initially, there were 7. To basically integrate and show some of the examples, like design for clarity, design for translation for multiple languages. Every single document needs to be translated to 7 languages, official languages, and then local countries will need to integrate that into their other languages. Most of the middle and low income countries will not design their own guidelines because they have no budgets like more richer countries, but they will use the ones of WHO. So how do we actually make sure that whatever is produced is relevant to them and they can use it? And which type of technological system you need to design there. This is just to give you the examples of how it works in practice. So, but essentially the impact of this work is, it's very small, it's design principles, but you have 194 states and 6 regions actually using this work, which is openly available today. So you can think about how can co-design support guideline developers to actually then make sure that it's integrated into practice as well. The other, the continuity of this work is pretty much something which I feel like it's also connected to education. So these guidelines can be very clinical, but can also be very focused on prevention and education. And one first example of actually the use of this template and those principles is the current guideline that WHO and UNICEF are developing on water hygiene systems. So it's a lot about, it's very simple essentially, like it's about washing your hands and making sure that everything is properly designed. But what they try to do for the very first time here, I'll go through those slides quickly. So in 2023, when they met for the first time, 48 participants from 18 countries, a big consultative process, they decided that they need to integrate the end user perspective and they need to think not just about the guideline itself, but about the implementation processes. Like how do we actually uptake and implement those guidelines? Because you would, I guess that uptake and implementation of those things are really hard and not necessarily taken into account. Like what's the cultural setting or the embeddings in specific settings? Here, for example, it's schools, it's restaurants, it's universities. How do they take that into account? How do we bring them on board? And so what are the principles and mechanisms to support that? And we were fortunate enough to actually test some of this work that I've presented there with them. So call for implementation guidelines, engagement and co-design and piloting, and they published a paper in BMJ to actually show that they're going to do it. The guideline will be available at the end of this year, This is just the process to show you that these guideline development works are very tedious. They're very long. It's the long consultation process, integrating end users, integrating researchers. This part of end user design process is something that they've never done before. So pretty much, how do we do it? And by end users, I don't mean patients in this case. I mean schools, restaurants, healthcare facilities, etc., who will be actually using those recommendations to the very, very end users in this specific case. So the part that we've done, and I'll try to move up because I do have other projects to share as well. So it's pretty much what I find interesting about this project is since they identified 10 champion countries, and they said, okay, how do we do the co-design on the ground, but not making sure that experts from the global north, from us, basically traveling there and making that work for them, but making sure that people are actually building their own capacity to do this work on the ground. So for the first time that happened to us, we actually trained 50 different facilitators in 10 different countries online and developed all the design tools with many constraints because you can't do the same design work, perhaps with people who haven't been facilitating those sessions for years, but simplified tools that they can use and also think about how we're going to integrate that in practice. So how do we use this as a way to enable and create and develop capability in different countries? So, I mean, this is a simplification of these design tools, like very long instruction pages, how do we develop the toolkit, how you can use it. So pretty much making sure that we don't design it for experts, but for anyone who can use those tools and then develop that. So those people in each setting, they had around 40 participants coming for a few days with at least 5 facilitators per country. And they were running those workshops independently and then basically colliding the results together. I think it's an interesting process because it shows co-creation and co-involvement, a little bit at scale, well, not fully online, but pretty much you need to take into account the constraints of organizing those things. And you need to think about how do we actually do it in the way of colliding these things together, which is, like coming from the design perspective, it somehow decreases the quality, perhaps, so visual, like you've seen the design principles, they look very beautiful. Here we have very simple tools. You need something which is simple, easy to print, easy to access. You can't allow yourself to design something very complex because it needs to be actionable right away. So you need to create those trade-offs and make these strategic design choices in a way. And just to finish with the last slide on that project, what's happening right now, I mean, I'm talking about PDFs and you'll be telling me like, we're in 2025, it's the world of AI and technology. Why are we still dealing with that? Like technology can support us changing completely the infrastructure of synthesizing evidence, accessing it, translating it into the local language. So during COVID-19, for the first time, those organizations actually implemented something which is called living evidence. So they've created a task force because the evidence was changing so quickly during COVID-19. So they've created an infrastructure, which is a bit quickly done. So now they're redesigning it to basically make sure that we have the process of a living evidence architecture that will allow us to do it online and actually update recommendations accessible to all with a new IT, potentially AI-enabled infrastructure in there. And if you're interested and have any ideas on the tools that you've seen being doing those similar things in a cool way, I mean, this is currently happening. And these are the photos from the workshop earlier this year in to go from there. So we kind of opened the whole Pandora box of co-design and complex systems. But what's the experience of participants coming to those projects, right? Okay, we have outputs, okay, guidelines, projects, prototypes being developed. But why people join? How do they relate to each other? How do we integrate and better design those systems that are actually enable participation online? And that's where Mark enters the room. So we do lots of work in terms of trying to understand these large-scale collaboration processes, teams dynamics, individual level participation. Mark, you can go and listen to his podcast that was done in one of the previous sessions. So I'll be just building on that a little bit to show you some of the snippets of what we do. So the project we are currently doing also with Chris Riddle from Northeastern is really to look into, okay, Open COVID-19. Many of you have heard about that project being done at LPI with Joggle a few years ago. So lots of people participating online. The network coming from Mark as well shows how individuals collaborated and what happened, which type of grants different projects were able to achieve for that project over time, over 2 years. So we have a big community, many individuals joining the different projects, creating teams, staying in teams or leaving. But why? What contributes to that? So what we've been doing right now is really look into the whole participation and trying to see how the attention direction happens. Like if Annalena posts a message, why Shab responds? Or perhaps Shab doesn't respond. Like what's the efficiency of those type of actions? And which type of architectures of directing attention can be more powerful or less in different settings? And we actually see a variety between more type of emotional architectures where it will be facilitating, bringing teams together, and more directional type of like tagging one specific person for a specific need, going to a specific outcome. And both are really valuable for different reasons. So we're trying to theorize and build recommendations based on if you're building any infrastructure, how do you direct attention online? First, to achieve certain outcomes in terms of performance, but also from the experience. Because what we also say, and what's interesting in there is like experience matters. How do we make sure that it's not extractive to people joining citizen science projects, joining crowdsourcing projects, but it's also contributing to their capacity building, new opportunities in the future, their relational well-being to some extent. And that's where the work that we started a few years ago on relational well-being, to me, that comes in. How do we integrate the material aspects of well-being? Because Maslow's pyramid, if your basic needs are not satisfied, you won't be able to be fully present. Subjective skills that you learn during those communities, and also relational perspective of actually being connected, contributing to the present and now the ecosystem of us, but also going to your local ecosystem and making sure that things are happening there at the same time. And this visualization and the construct is coming actually from anthropology, the work of Sarah White, designed specifically for Global South. So it's a lot of co-design to basically create instruments adjusted to the local needs. And we had a chance to work with Yoma on that last year to basically see how, in case of youth participants joining the learning different digital skills on Yoma, like what's their relational well-being when they join a team of students working on specific projects, for example. And you can just see here some, I know you can't read, but some elements, and we can send you the results. Basically, the survey was designed to see how they would rank different relational well-being skills. And you really see in green here, the elements related to relational well-being are much more present than actually elements related to, of course, gaming and playability, also due to a limited nature of those projects. And here is just a quote of one of the participants as well. So all of that to say, okay, we try to understand better how the attention structured mechanisms work, which type of infrastructure we develop, but also how do we make sure that the experience of anyone who is participating is just, equitable, inclusive, and also how does it contribute to their relational well-being. And where are we now with all of that? I feel like the project we're currently doing is kind of bringing it all together. So we were fortunate enough to receive funding from INR this year. So we're just starting the project on the continuity of what has been done with IGM over the past years. Many of you heard about, how many of you are aware of IGM? I've seen work on that. So we have a real expert of IGM, Mark, who has been working on international genetic engineering machines competitions for years. So it's a big context. So it's 22 years since IGM was created. So the first ever competition was happening in 2003. 5 teams from MIT. Towards now, just to give you a context, 4,578 teams, 65 countries, 86,000 individuals who actually participated, joined that ecosystem that essentially worked as a challenge-based competition where students from different universities and research centers join for 6 months. They attend the jumboree, they can get the prizes, they win, and there are PIs that are actually involved to continue and develop their research. What's interesting about this context, so from a competition, it evolved into much more of an ecosystem. So you have now startup communities. There are more than 143 startups the last time I counted that were actually created as part of this ecosystem. You have IGEM alumni. You have returning people coming back to the competition. They often talk about the IGEM experience, and it's a life-changing event to some extent. So it's a very interesting context to actually study all the constructs that I've presented until now, going from the use of co-design in large-scale settings, because we would like to distill practices for open science based on that. Interdisciplinary settings, it's the individual level interactions, because everything that they do is recorded online, so we can actually see why they join, what do they learn, which type of skills, between what they declare as what they want to learn and what they actually do in the projects. What do they gain? Do they come back? Which type of scientific outcomes we get from these projects? So what we do now is a really multi-level study for the next 2 years. Please come join us if you want to help. To basically look into, this is a print screen. This is a figure from actually the grant where I just wanted to show you that we are really trying to bring these different elements together by blending ethnographic studies, co-design work, participatory work into basically an analysis of bio-bricks, networks, to actually see how do these things interact, how do they relate to each other at the multiple level. So we have basically trajectories of participants in IGEM. Like there are scientists who have been there for more than 10 years. So why are they staying? Like how did they build their own career based on this competition? What's the impact on research, but also on relational skills? So the reason I introduced the relational well-being is because we would like to look into that as well. What are the structural elements? I mentioned structures at the beginning of this talk, saying, okay, organizational structures can enable or hinder collaboration. So depending on how those organizational structures are set within the jamboree, within the competition, but also within each team, might actually enable them or decrease the level of participation and understanding and the way the teams operate. And then the part that we started already is also, it's 22 years. How do we study the ecosystem? How do we look at the evolution of the community over time? And pretty much how do we, I feel like it's one of the unique settings where we can really look into the ecosystem of multi-level collaboration internationally. Because the funny fact as well, it started pretty much as a US-driven competition, becoming very European and international. But now half of the teams participating is actually in Asia Pacific, and many of them are in China. So it's also showing how the evolution of the field of synthetic biology and how occurred over time. How am I doing on time? Okay, I have one slide left, so that's great. So all of that to just kind of bring it all together, the takeaways that I had for you, and I started to develop them a little bit more, is for me, co-design, collaborative design, design thinking processes, they enable us to understand this contextual relevance. Often you might hear, okay, when we study very large scale collaborations, co-design is not very efficient, it's very time consuming, it's hard to implement, all of that is true. But without that, we actually do not embed that in practice. It's really hard to actually translate those outcomes to someone, as I mentioned, in Zambia or in Kenya or somewhere else, to be actually, to have this contextual and cultural relevance, because they're absolutely critical. Temporal embeddedness is key. That's why some of these projects take years. WHO, it's been 3 years, some of the others at least 3-4 years. So you can see the evolution. It doesn't mean that you have to be present all the time, but you need to return to actually see what's happening, what evolved, what changed, because these processes, they unfold over time. Need for mixed methods. That's why we are trying to blend different ideas and different elements of combining qualitative work, quantitative work, trying to look into computational analysis, network science, etc. Participatory attention building. So referring to the process that we described before, is like the structures in place, the architectures in place, they matter. If we just, for example, interview individuals without actually understanding in which organizational settings they operate, we do not get the full picture of what's actually happening. Power and equity need more embedded attention. I think we talked about that. And again, I think we have an interesting opportunity also to look into learning ecosystems in the Global South with Kathy and Olivier and the team, and actually trying to see what are these peer-to-peer networks that need to be put together to enable these learning ecosystems to flourish in the future. And then the final quote is change is relational, cultural, it's not just procedural. So all these things take time, they require attention, but they are very powerful because you really learn with those settings at the same time. I'll stop here. Thank you so much. Hopefully that was interesting.
Maybe sometimes contributing, maybe not. Then there will be people who don't even show the meeting, but receiving the email, they don't want to drop out of the email, so want to be informed. So there is kind of wider circles, completely not producing data in those situations. How do you take them into your approach, if at all?
That's an amazing point. And I mean, we all know that in ideation and brainstorming sessions or in design, there are people who are very vocal and there are the ones who might participate less, but they're still very, they might be somehow even enablers of those type of collaborations happening. So for me, when you look into collaboration, it's important to see why, not just why people join, but why they leave, why they stay, even if they're not vocal, and actually make sure that all voices are heard. And it's a combination of things. Sometimes it's if you try to interview everyone, especially people who leave, especially people who are silent. One thing, same, if it's a completely online setting, you can really see sometimes it's not just what they post, but how much do they stay online, for how long. Do they react to messages, like reactive participation? Maybe they are just very emotional. They click, they like, they post, but they don't necessarily contribute, but it's a form of contribution. So trying to, again, I think there is no one specific method that will do it all, but how do we combine different ways of looking into that, depending on the setting, to make sure that we don't exclude that? And also to add to that, it's not easy. It's also a real challenge. For example, we're going tomorrow to a meetup in Germany for IGM to actually start doing this work, and tomorrow it will be just 25 teams and 250 people. But in IGM, often what you manage to do, you interview people who succeed. But what about the ones who don't? So our entire challenge for this project will be to try to dig those teams and make sure that we integrate their voices as well. And I would love to try.
People who show up to some meeting, like they have a role. No, exactly. It's the same for me. It's another 2 hours. So even just being audience, just being the public that the others talk about, and if something really provokes them, then it needs to be something. For maybe it's kind of okay, priority.
And that's where the participation architecture will come in. Not just at leaders and people who participate, we're also looking into everything, like what happens, like if there is a like or reaction, so they join the channel and they stay silent, but they still stay. So you kind of look into their activity and you don't exclude them. So that allows you to kind of look into that in a more holistic way. But they see Martin wants to say.
May I ask a question also?
Oh, yes, please. Oh, well, yes, please.
Sorry.
Go ahead.
Please go ahead.
Hello, I'm Mehmet Aküs. Thank you for this great presentation. First of all, let me say that I am fully convinced about this approach. Right now, I'm leading a project in the field of education, and I'm trying to implement this kind of collaboration, but it's quite difficult. You gave most of your example is about the global south, but in France here, I'm seeing that there's also some challenges regarding this approach. For instance, and I'm pleased that this presentation took place in Learning Planning Institute. I tried to reach out to Learning Planning Institute to have a discussion, but until now, I didn't be able to present my project and have a discussion. Maybe I didn't engage with the right people, but please let me know how I can do it. The question is here, how in a practical way can we implement this approach, taking into account the local context? You give example about the WHO. I understand that they have a lot of resources, financial one and people one and so on, but from a local context, how can we start this kind of discussion with different actors?
Okay, I think it's a great point, and maybe just to quickly jump into your point of reaching out to Learning Planet, I think you have right people in the group, so please, someone will follow up with you. For the participation and education, I mean, the context like France is very interesting, and I did not introduce the projects like Epidemium or the work we've done on Open COVID. I mean, Open COVID is international case, but it actually started in France, and Epidemium is a very French context as well. So these things do happen, and obviously they need to integrate the cultural perspective in there. And you'll be surprised, WHO, most of the work that is actually happening with WHO is in kind. These are very small budgets. It's all dependent on the external grant applications, and lots of people actually join often those communities because they're convinced and they want to make that work happen. And that was my experience as well when I was involved in studying the epidemium community, like on big data for cancer epidemiology at La Payas a few years ago. People we interviewed, many of them were coming not because they had any health skills or like cancer epidemiology background or big data science background. They actually came because they have lived experience. They wanted to be part of that because they wanted to contribute. Perhaps they had a prior history of cancer in the family, or perhaps they just wanted to contribute to this social mission. All that to say, I feel like there are always motivated people. Maybe it's a bit easier to attract people who already did PhDs or masters, and actually they are already ready to contribute. The question is like, how do we integrate others who perhaps do not feel comfortable contributing to these things? And citizen science, I think, does a bit of work in that perspective. That's one thing. So thinking, how do you integrate participants and how do you kind of communicate the initiative so in the right places to integrate those people, and how do you think about incentives for their contribution? So it's not extractive, but there is something, and I'm not talking about financial incentives, but something that will be there for them as an opportunity to learn, to contribute, and to be part of the initiative in the first place. And the last comment for me is, when you do these things, you need to think who are, let's say, pillars. You need to think about who will be those local leaders or pioneers or structural kind of, Muki earlier today said, okay, we have the silent participants. Sometimes silent participants are actually bridges. Who are the bridges in the community who will actually just blend communities together without necessarily being local? So you need all these different stakeholders to make it work. But we can talk more about that. And thanks for your question.
Thank you.
Yeah. Okay. Yes.
You mentioned business. I'm interested in understanding real examples of connecting health projects with schools, with education. Could you give us an example of some lines to get ideas? Because I looked some texts or materials releases that could interact with schools. That could be an idea, but I want to listen about what you have heard, what you have found in the topic. Thanks.
In the topic of, just to rephrase, in the topic of bringing different disciplines into schools specifically. Yes. Are you talking about
into schools?
Into schools, okay. Citizen science, again, and youth participation is a great example of that. It's really trying to see, and I think Learning Planning is doing a lot in that perspective, is really, and I think many people here would be even better positioned than myself to give you the examples happening here. But in many settings, I feel like it's co-involvement. It's pretty much it depends how you want to contribute, because you can design different ways of them contributing. It can be help you formulate on the challenge you want to focus on a specific case. basically go there, do a bit of like some workshops, collect their ideas, and then fed it into, for example, your citizen science project or a participation, and then bring researchers together to kind of see what's their perspective. It can be done coming towards the end of the participation, where you kind of share the results to make them react, to make them participate. But for me, it depends on why you want them to participate. Is it to learn? Is it to get their perspective? And depending on that, you can co-design this involvement in a different way. But I'm happy to give you more specific details once I know how you want to involve them. But I think it's very relevant. I think you can learn so much from your participation as well. And they can be, I mean, you can even, like, if your project is relatively big and you have like a committee, they can be part of that. They can actually help you design things to include youth participants better in the participation. And you can give them equal rights to some extent to participate in those settings. Yeah.
Other questions? Mark?
Maybe a question on, I also work on the virtual conference, so I'm happy to see that. And I was wondering, so there's this design guidelines and these practices, and then they're implemented, and so they're made to be, the co-design is at the early stage, and they're made to be then at that stage done in a way that is most, I guess, fit to the audience. And I wonder a bit about then the perennity, how you know, as things evolve, is there any evaluation, continuous evaluation that allows this co-design to also be longitudinal in a way, or how would that be implemented without so much funding, as you said?
This is a great point, and this is actually where this architecture is moving towards. So like when they say, okay, we have and it's a big gap for them today. So we have, depending on the country again, because different countries will have different budgets allocated to those type of activities. So, for example, on that WASH guideline, what they do, they don't just want to now design the guideline, but they want, that's why there is a lot of co-design in these 10 champion countries and then extended that. Is really how do we design the implementation? And within this implementation and uptake, you think about how we're going to evaluate that going forward, because things change. So what are these learning evaluation, like what will be the evaluation framework integrated that will allow them to see what works, what doesn't? Because everyone who works in Agile, you don't design something for a static world, so you will be implementing certain things every, 3 months, checking whether it worked, where it didn't, how do we adjust? So they're trying to change the entire mindset of those things from that perspective. And it's not easy. But like the whole idea is really how do we move to that process of evaluation is integrated and what they have started to do. But I guess it's a long way forward, and it depends on where they are. Because, for example, I mentioned this living evidence, and basically what they do now, they realize that this global guidelines documents, what clinicians and end users really need, it's not the, you need the transparency of how it was developed, but it's actually the recommendations. And then if these recommendations change, how do I know that they've changed and how do I implement them? So they're trying to create the architecture that will integrate that and also integrate the evaluation of those aspects there. But we can talk more. There is no one system that was designed yet. And my dream would be that it's not just from the evaluation and performance, but also from the experience perspective. Is like why do people join and what happens? But hopefully one day.
Other questions in the room?
Yeah.
Or maybe a comment on what you're saying is it could be like, you have the sites where you have the recipe of, and then you have comments and so say, oh, I added this and that. So it could take different forms and simplification for this application.
Yeah, definitely, because also there is no one size fits all. Like you develop these guidelines, for example, or anything like policy recommendations, but each cultural context is different. Even the way the healthcare is organized is different, and the same is in education. So they would need to have resources locally to be able to then integrate and translate, and that's where this whole work is kind of moving. How do we, like the whole thing on the living guidelines, it's not at WHO level, it's actually Asia Pacific level. So it's like, how do we do it regionally and how do we do it locally? So that, because that's where the work is happening, and your arborism structure, I think, is kind of in the right direction. Yes.
So how are you going to create this kind of editable or replicable document?
There is one
Can
already.
you consider that? Because during COVID, there was some examples of that, and I've seen also some other examples. So we were thinking about it, the discipline science and kind of guidance about training and other things to create it as a Google Doc or as a OneDrive doc that basically someone can take and they're invited actually to replicate it and start editing it to fit in the local context.
Definitely, like, I mean, I was actually in the workshop at 5 a.m. on Monday talking about these architectures because it was happening in Indonesia. And they did design a system called Magic App to help them with the guidelines that actually does that. But it doesn't, it's not open source. And it's very hard for people because, I mean, a company took an opportunity during COVID to design that, so they used it. But again, now how, if we're thinking about distributed architecture, and especially in the open source available to all, do something that will allow you to take all the, I don't know, guidelines and policy recommendations at the regional level or international level and say, okay, in my context, in Kenya, for example, this works, this doesn't, we need to do that, we need to translate it in practice. So your editable version becomes almost like you have a core of the platform and you create your own little module, but they're still connected. So that's how
you almost need something like, I'm thinking on 4 physical objects, because for example, spreading the knowledge about this, there is really still no competition for physical objects, okay? Because the digital object, you need to keep on reminding people that the digital object exists somewhere. Whereas if you have a piece of paper or a booklet about the design process, and it's sitting in a library, people will hit it in different cases, or it's sitting on someone's table and other things. But what you would want, I would guess, is to have some EOI or something that leads you to the documents that is then saying, okay, you've seen this booklet, now go to Zillow, which is something, infrastructure that might exist for a long time, and get the document and start doing things with it and change it and update it to your local context. Maybe it will be interesting to see, because there is so many dropouts of people in the design process that they don't get to this stage. And again, it's another problem of participation.
I mean, I find it 100% relevant and would be useful. And I would follow up on that, because now that kind of like the whole idea of that workshop was really to identify with the local clinicians and users who are actually using those systems. How do they use them? How do they access? Which type of functionalities they want before actually they start to rethink this process? And I mean, all these type of ideas that came up. But then essentially there's always a question of funding, of course. So like how and what is this minimal viable product that everyone needs to be able to then adjust? And I think, like this, we should talk, because they are currently thinking about that.
Thank you for your amazing presentation. And back to when I was doing a project between Amsterdam policymakers and the Brazilian policymakers on a context, of course, not of public health, but indirectly, but sustainability and floods. Because in South Brazil we suffered lots of floods, and Amsterdam, Rotterdam as well. So what we did was co-creation sessions between the 2 countries, so North and South Europe. And we designed different perspectives and different solutions based on nature-based solutions for floods. And it was really nice, it was really rich to have these pinpoints of different ideas from different stakeholders, right? And so we had the different missions. So we went to farmers, we listened to farmers in Brazil and Rotterdam to have their point of view. Of the situation, the government, and also the researchers, right? So it's like this. We have a toolkit, but we need to go out of the box and fit into a local solution, right? So thank you. It's really nice.
No, a very interesting case, and I mean the cool testimony of there is a lot of amazing work in this realm that is happening everywhere. And sometimes, like, how do we bring it together and how do we learn from each other? So if you have it published anywhere or a toolkit that you can share with us, that would be amazing, because it sounds very, very relevant.
Final question? Online? No. Then I guess this is it. Thank you very much, Olga. And we will meet together next time on the 12th of June with Karina.